What if you lived in a city where every day, someone you know, your neighbor, your coworker, your child's teacher, could die from a drug overdose? What if the streets you walk are lined with people battling addiction, not because they chose it, but because the system failed them? This isn't a hypothetical nightmare. It's the daily reality for millions of Americans. Before we dive into this shocking investigation, please subscribe to Minimalist US. Hit that subscribe button now. It helps us continue bringing you the hard-hitting stories that mainstream media won't touch. In 2024, over 84,000 Americans died from drug overdoses. That's one person every 6 minutes, dying from substances that have flooded our streets like a poison tsunami. We're diving into the 5 most drug-devastated cities in America: Baltimore, Philadelphia, San Francisco, Dayton, and Seattle, where fentanyl, meth, and despair are tearing lives apart faster than bullets in a war zone. These aren't just numbers on a government report. They're stories of people, families, and entire communities drowning in an epidemic that our leaders can't seem to stop. Picture walking down streets where stepping over overdosed bodies becomes routine. Imagine playgrounds littered with needles, where children can't play safely. Think about emergency rooms so overwhelmed with overdose victims that heart attack patients wait in hallways to die. This crisis didn't happen overnight. It traces back to the 1990s with the overprescription of opioids like OxyContin, which hooked millions on painkillers legally prescribed by doctors. Big Pharma knew these drugs were addictive, but profits mattered more than lives. As prescriptions tightened, desperate users turned to heroin, and then came fentanyl, a synthetic nightmare 50 times stronger than heroin, often mixed into other drugs without users knowing. By 2025, fentanyl is involved in nearly 70% of overdose deaths nationwide. The DEA seized enough fentanyl in 2024 to kill the entire US population twice over. Yet it keeps flooding in from Mexico and China. Why are these 5 cities ground zero for this massacre? How did it get this catastrophically bad? And what can we do to stop entire American cities from becoming open-air morgues? The answers will shock you, enrage you, and hopefully inspire you to demand change. Baltimore, Maryland stands as the undisputed king of America's overdose nightmare. A city where dying from drugs has become as common as catching the flu used to be. Picture a place where 1 in every 550 people dies from drugs each year. In 2023, Baltimore recorded over 1,000 overdose deaths, a rate of about 180 per 100,000 residents, nearly 9 times the national average. Even with a slight drop to around 900 deaths in 2024, that's still 150 per 100,000, making Baltimore the deadliest major city in America for drug users. Fentanyl is the grim reaper stalking Baltimore streets, involved in 85% of these deaths. Imagine a drug so potent that just 2 milligrams, smaller than a grain of rice, can kill you instantly. This isn't heroin anymore. This is chemical warfare against America's most vulnerable populations. Emergency rooms saw over 5,000 opioid-related visits in 2024, a 25% jump from the year before, turning hospitals into battlefield triage centers. How did Baltimore become this hellscape? The city's drug nightmare stretches back to the 1970s, when heroin took hold as steel mills and factories shut down, gutting over 100,000 jobs by the 1990s. Neighborhoods like West Baltimore, where poverty now affects 22% of residents, double the national average, became breeding grounds for addiction and despair. The 1990s brought crack cocaine, devastating communities already on their knees from economic abandonment. By the early 2000s, prescription opioids like OxyContin flooded the streets, pushed by unethical pill mills, crooked doctors and pharmacies that handed out addictive painkillers like candy. When law enforcement finally cracked down on these legal drug dealers, heroin filled the void immediately. Then, around 2015, fentanyl arrived like the angel of death, turning routine overdoses into mass casualty events. The Freddie Gray protests in 2015 exposed the city's racial and economic divides, but they also disrupted addiction services when the city needed them most, causing a 20% spike in deaths that year. Baltimore's port, a massive hub for international trade, makes it a prime entry point for drugs smuggled from Mexico and China, with cartels using the city as their East Coast distribution center. Substance use disorders grip 15% of Baltimore's adults, almost double the national 8%. Black men over 50 are hit hardest, with overdose rates 4 times higher than their white counterparts, a stark reflection of systemic inequities that have poisoned this city for generations. Mental health care is woefully underfunded, with only 40% of those needing treatment actually receiving it, leaving desperate people to self-medicate with deadly street drugs. The human cost of Baltimore's drug apocalypse extends far beyond the morgue statistics. Homelessness affects 2,500 people in the city, with drug use rates 30% higher among those living on the streets. Imagine trying to recover from addiction when your bedroom is a cardboard box and your medicine cabinet is whatever deadly poison a dealer will sell you for $5. Overdose deaths are costing Baltimore $1 billion annually in healthcare expenses, lost wages, and policing costs. But the real destruction happens to families. Child welfare cases tied to parental addiction rose 15% in 2024, leaving thousands of kids in foster care or worse, sometimes finding their parents dead from overdoses. Picture a 6-year-old calling 911 because mommy won't wake up, or a teenager selling drugs to buy food because addiction destroyed their family's income. Drug-related homicides keep Baltimore's murder rate at 50 per 100,000, among the nation's highest. These aren't just statistics. They're neighbors killing neighbors over territory, money, or drugs. Entire neighborhoods feel unsafe, trapped in a cycle of poverty, addiction, and violence that seems impossible to escape. Public health is crumbling under the weight of this crisis. 10% of drug users are infected with HIV or hepatitis C from sharing needles, turning addiction into a slow-motion death sentence even for those who survive overdoses. Businesses suffer as addiction drives away customers and employees, creating economic dead zones where legitimate commerce can't survive. Yet Baltimore refuses to surrender. The Baltimore Health Department handed out 50,000 naloxone kits in 2024, reversing 2,000 overdoses, literally bringing people back from death. Needle exchange programs cut infections by 20%, proving that harm reduction saves lives even when abstinence seems impossible. A $100 million opioid settlement from pharmaceutical companies is finally funding treatment centers, though waitlists remain criminally long. Housing First programs, which provide homes without requiring sobriety first, kept 1,000 people off the streets with a 90% success rate. This revolutionary approach recognizes that stable housing is the foundation for recovery, not the reward for it. Community groups like the Baltimore Harm Reduction Coalition train peers to save lives, offering hope where institutions have failed completely. But the crisis persists because the root causes remain. Social media posts lament federal funding cuts, with advocates calling reduced Housing First budgets heartless policy that kills people. Others argue for tougher policing, but criminalizing addiction costs 3 times more than treatment while solving nothing. Baltimore's story is one of resilience amid systemic abandonment, where communities fight to save themselves because help from above never comes. Philadelphia, Pennsylvania ranks as our second most drug-devastated city, where the Kensington neighborhood has become infamous as the East Coast's largest open-air drug market and human tragedy. Walk down Kensington Avenue, and you'll witness scenes that look more like a zombie apocalypse than an American city. People openly using drugs, some collapsed on sidewalks like discarded mannequins, others trading death in baggies in broad daylight while children walk to school. In 2023, Philadelphia's overdose rate hit 130 per 100,000 residents, with over 1,200 deaths. Even with a drop to 120 per 100,000 in 2024, that's still 6 times the national average. Fentanyl drives 80% of these deaths, but a new monster emerged in 2023: xylazine, nicknamed Trank, causing gruesome, necrotic wounds that make users look like walking corpses and contributing to 20% of fatalities. Philadelphia's descent into drug hell mirrors Baltimore's trajectory, but with its own unique horrors. Heroin took root in the 1960s, but the 1990s brought pill mills that turned Pennsylvania into prescription opioid central, hooking hundreds of thousands on legal drugs that doctors knew were addictive. By 2010, as prescriptions were finally restricted, heroin surged to fill the desperate demand. Fentanyl hit Philadelphia's streets in 2013, and by 2015, overdoses had doubled. Kensington, once a thriving working-class neighborhood where families built lives around steady factory jobs, became a post-apocalyptic wasteland after those factories closed, leaving behind 40% poverty and 15% unemployment. The neighborhood's proximity to New York's massive drug distribution networks made it a natural magnet for traffickers looking to establish territory. Emergency calls for overdoses reached 10,000 in 2024, a 10% increase that's overwhelming first responders who sometimes make multiple overdose runs to the same block within hours. Methamphetamine and cocaine use jumped 15% in 2024, as polydrug addiction becomes the new normal. Most terrifying of all, 5% of teenagers now report opioid abuse, meaning an entire generation is growing up thinking this nightmare is normal. The tranq epidemic represents a new level of horror. Unlike pure fentanyl overdoses that can be reversed with naloxone, xylazine-laced drugs cause wounds that resist healing, leading to amputations and gruesome infections. Users develop open sores that look like severe burns, earning tranq the nickname zombie drug. These wounds appear even in people who don't inject, suggesting the chemical causes tissue death throughout the body. 12% of Philadelphia adults battle substance use disorders. With mental health treatment almost non-existent, 30% of addicted residents have untreated depression, creating a perfect storm of psychological and chemical dependency. The pandemic's isolation spiked overdoses by 25% as people lost jobs, homes, and hope simultaneously. The toll of Philadelphia's drug apocalypse reaches far beyond Kensington's open-air misery. The city loses $2 billion annually to addiction through healthcare costs, lost productivity, criminal justice expenses, and social services. Hospitals are overwhelmed with 20,000 drug-related emergency room visits annually, turning medical facilities into revolving doors for the same desperate people overdosing repeatedly. Crime in Kensington is 30% drug-driven, with shootings up 15% as dealers fight for territory in a market worth hundreds of millions of dollars. But the violence isn't just between criminals. Desperate addicts commit robberies, burglaries, and assaults to fund their next fix, making entire neighborhoods unsafe for families trying to survive. The children suffer most. 1,000 kids entered foster care in 2024 due to parental addiction, overwhelming a system already stretched beyond capacity. These children often witness traumatic scenes, parents overdosing, drug deals, violence, that create lasting psychological damage. Health issues from intravenous drug use, like endocarditis, heart valve infections, rose 25% as dirty needles and contaminated drugs destroy bodies from the inside. Philadelphia's racial disparities make this crisis even more devastating. Black residents face 2.5 times the overdose risk of white residents, tied to decades of disinvestment, discriminatory policing, and limited access to quality healthcare. Communities that were already struggling with poverty and systemic racism now face the added burden of watching their neighbors die from drugs. Homelessness affects 6,000 Philadelphians, with drug use rates 40% higher among those living on the streets. Encampments line Kensington's blocks, creating temporary cities of people who've lost everything to addiction. These camps become centers of disease transmission, violence, and despair. Yet Philadelphia fights back with innovative approaches that save lives daily. The city distributed 100,000 naloxone kits in 2024, teaching family members, friends, and strangers how to reverse overdoses. Fentanyl test strips were decriminalized in 2021, allowing users to test their drugs and potentially avoid fatal doses. The controversial overdose prevention sites proposal faced massive public backlash, with critics calling them drug dens that enable addiction. But pop-up prevention sites operating in legal gray areas saved 500 lives in 2024, proving that supervised use prevents deaths even when it doesn't prevent drug use. A $200 million opioid settlement provides funding for medication-assisted treatment programs that use drugs like methadone and buprenorphine to help people recover without the agony of withdrawal. Prevention Point's needle exchange programs cut HIV infections by 50%, showing that harm reduction works even when recovery seems impossible. San Francisco, California, ranks third on our list of America's most drug-devastated cities, creating a bizarre dystopia where tech billionaires step over overdose bodies on their way to work. The Tenderloin district has become notorious for open drug use, with needles littering sidewalks like fallen leaves and overdoses occurring so frequently that they barely register as news. In 2024, San Francisco's overdose rate stands at 80 per 100,000 residents, down from 90 in 2023 but still horrifically high for a city that prides itself on progressive values and wealth. Over 800 people died from overdoses in 2023, with fentanyl dominating 75% of these deaths. The city's 8,000 homeless residents face a staggering 50% drug use rate, turning entire neighborhoods into open-air addiction treatment centers without the treatment. The crisis has roots in the 1960s hippie movement that made San Francisco synonymous with recreational drug use, but the real devastation began with crack cocaine in the 1980s and escalated with prescription opioids in the 2000s. The tech boom that made Silicon Valley famous also drove rents to an average of $3,000 for a studio apartment, pushing low-income residents into homelessness where drugs become a survival mechanism against despair and cold nights. Fentanyl hit San Francisco's streets in 2018 and tripled overdose deaths by 2020, turning the city's drug problem from manageable to catastrophic. The city's massive port facilitates drug imports from Asia and Mexico, while a shortage of 500 mental health beds leaves thousands of people with psychological problems untreated and vulnerable to self-medication. Emergency rooms logged 15,000 drug-related visits in 2024, up 10% from the previous year. Meth and cocaine use affects 20% of adults in some neighborhoods, creating complex polydrug addictions that resist traditional treatment approaches. The pandemic's isolation spiked drug use by 40% as people lost jobs, social connections, and hope simultaneously. Asian and Latino communities saw a 30% rise in overdoses in 2024, marking a troubling demographic shift as the crisis spreads beyond its traditional boundaries. These communities often face additional barriers to treatment, including language barriers, cultural stigma around addiction, and immigration fears that prevent people from seeking help. The impact extends far beyond the human toll, though that remains devastating. San Francisco spends $1.5 billion annually on the drug crisis through healthcare, social services, and law enforcement. Tourism, a major economic driver, has dropped 20% due to visible drug use that shocks visitors expecting California's postcard image. Crime increased 25% in areas with heavy drug activity, as theft and violence follow addiction like shadows. Health issues from injection drug use, including abscesses and collapsed veins, plague users who can't access clean supplies or medical care. San Francisco has responded to its drug crisis with both innovative harm reduction programs and frustrated retreats from progressive policies. The city distributed naloxone and fentanyl test strips widely, reversing 3,000 overdoses in 2024 alone. Housing First programs successfully housed 2,000 formerly homeless individuals, with $300 million in pharmaceutical settlement funds providing treatment expansion. However, public frustration with visible drug use led to policy reversals in 2024. Harm reduction sites faced community backlash, with residents demanding enforcement over compassion. Social media posts call San Francisco a failed experiment in drug policy leniency, while others demand more housing and mental health services. The city struggles to balance progressive ideals with public safety concerns as voters grow tired of stepping over human misery. Moving to our fourth-ranked city, Dayton, Ohio represents the Rust Belt's unique drug devastation. With a 2024 overdose rate of 100 per 100,000, extremely high for a mid-sized city, Dayton recorded 400 deaths in 2023. This rate rivals major metropolitan areas despite Dayton's smaller population, showing how the opioid crisis has devastated America's industrial heartland. Dayton's tragedy stems from deindustrialization that cost the city 50,000 manufacturing jobs over 2 decades, leaving entire communities without economic purpose. Poverty affects 30% of residents, creating desperation that makes deadly drugs seem like reasonable escapes from hopeless circumstances. Pill mills flooded Ohio in the 2000s, with some counties prescribing enough opioids for every resident to have a month's supply. When prescription crackdowns began, heroin filled the void immediately. Fentanyl arrived in 2016 and caused overdose rates to spike 50% within 2 years. The city's location along major interstate highways makes it a natural distribution point for drugs moving from Mexico through major cities to smaller communities across the Midwest. Non-fatal overdoses hit 2,000 in 2024, overwhelming emergency services in a city with limited resources. 10% of teenagers report drug use, meaning an entire generation is growing up in a community where drug abuse appears normal. Rural-urban drug pipelines connect Dayton to surrounding counties where treatment options are virtually non-existent. Mental health access remains severely limited, with months-long waitlists for treatment programs. The economic costs hit $500 million annually, devastating for a city Dayton's size, while families disintegrate under the pressure of addiction, poverty, and hopelessness. Yet Dayton fights back with community-driven solutions. Naloxone programs operated by local volunteers have saved hundreds of lives, while medication-assisted treatment expansion offers hope for recovery. Seattle, Washington, rounds out our top 5 as America's 5th most drug-devastated city, with a 2024 overdose rate of 70 per 100,000 residents and over 1,000 deaths in 2023. While lower than our other cities, Seattle's crisis reflects the Pacific Northwest's unique challenges with homelessness, tech inequality, and drug policy experiments that have produced mixed results. Fentanyl drives 70% of Seattle's overdose deaths, but the city also faces significant methamphetamine problems that have persisted since the 1990s. The 2008 recession brought prescription opioid abuse that transitioned to heroin and then fentanyl, following the familiar American pattern of legal drugs leading to illegal ones. Seattle's 12,000 homeless population faces extremely high drug use rates, with addiction both causing and resulting from housing instability. The tech industry boom that made Seattle wealthy also created massive inequality, where software engineers earn $200,000 annually while service workers can't afford studio apartments. This economic segregation pushes vulnerable populations toward drugs as housing becomes impossible to obtain. The city's progressive drug policies, including decriminalization efforts and harm reduction programs, have produced controversial results. Supporters point to lives saved through needle exchanges and supervised consumption sites, while critics argue that permissive policies have enabled open drug use that makes neighborhoods unsafe. Drug-related crime affects tourism and business districts, particularly around Pike Place Market and Pioneer Square, where visible drug use conflicts with Seattle's image as a clean, prosperous city. The economic impact reaches hundreds of millions annually through healthcare costs, law enforcement, and lost economic activity. Seattle's response includes extensive harm reduction programs, settlement funding for treatment expansion, and innovative approaches to addiction medicine. However, political battles over drug policy continue as residents demand both compassion for addicted individuals and safety for communities. The crisis reflects broader regional patterns, as rural Washington communities also struggle with meth and opioid problems that funnel users toward Seattle's services and drug markets. Interstate smuggling routes bring substances from Mexico and Canada, while the city's ports facilitate international drug trafficking. Mental health services remain inadequate for the scale of need, with many addicted individuals cycling between emergency rooms, jails, and the streets without receiving effective treatment. The intersection of mental illness, homelessness, and addiction creates complex problems that require coordinated responses across multiple systems. Community organizations continue providing life-saving services despite political uncertainty and funding challenges. The debate over drug policy approaches, enforcement versus treatment, abstinence versus harm reduction. Understanding America's drug crisis requires examining the interconnected web of factors that created these urban nightmares. This isn't simply about personal choices or moral failures. It's about systemic collapse that makes deadly drugs seem like rational responses to impossible circumstances. Economic devastation forms the foundation of addiction epidemics. Baltimore, Philadelphia, Dayton, and countless other cities lost hundreds of thousands of manufacturing jobs as companies moved production overseas. Entire communities built around steady employment watched their economic foundations crumble, leaving behind poverty, hopelessness, and populations vulnerable to any substance that could numb the pain of watching American dreams die. The pharmaceutical industry bears enormous responsibility for creating this crisis. Companies like Purdue Pharma knowingly marketed addictive opioids as safe for routine pain management, bribing doctors and misleading patients while earning billions from human suffering. When legal opioids became harder to obtain, Mexican cartels and Chinese chemical manufacturers filled the demand with deadlier substitutes. Racial and economic inequalities amplify addiction's impact. Black communities face higher overdose rates despite lower initial drug use, reflecting systemic healthcare discrimination and centuries of economic exclusion. Poor communities lack resources for treatment, prevention, or recovery support, turning addiction into a death sentence that wealthy areas can often survive. Mental health system collapse forces millions to self-medicate with street drugs. America's decision to close psychiatric hospitals without creating community alternatives left people with serious mental illness homeless and untreated. Depression, anxiety, PTSD, and other conditions drive people towards substances that temporarily relieve psychological pain, but ultimately destroy lives. The criminal justice approach has failed catastrophically. Arresting and imprisoning people for addiction doesn't reduce drug use. It destroys families, eliminates employment opportunities, and creates cycles of incarceration that make recovery nearly impossible. Countries that treat addiction as a health problem rather than a crime show dramatically better outcomes. Geographic factors matter enormously. Port cities like Baltimore and San Francisco become natural entry points for international drug trafficking, while interstate highways turn places like Dayton into distribution hubs. Rural areas lack treatment infrastructure, forcing people to travel hundreds of miles for help that may not be available. The COVID-19 pandemic accelerated every aspect of the crisis. Isolation, job loss, and stress drove increased drug use, while disrupting treatment services and social support networks. Economic uncertainty made desperate people more willing to try dangerous substances, while supply chain disruptions made street drugs more unpredictable and deadly. Despite the overwhelming devastation, evidence-based solutions exist that can save lives and rebuild communities. The question isn't whether we know how to address this crisis. It's whether we have the political will and resources to implement what works. Harm reduction approaches save lives immediately without requiring people to achieve sobriety first. Needle exchange programs prevent HIV and hepatitis C transmission while connecting users to treatment services. Naloxone distribution has reversed millions of overdoses, literally bringing people back from death. Fentanyl test strips help users avoid fatal doses by testing substances before consumption. Safe consumption sites, controversial but effective, allow supervised drug use that prevents overdoses while providing access to medical care and social services. Portugal's decriminalization model, which treats drug use as a health issue rather than criminal behavior, has dramatically reduced overdose deaths and drug-related crime. Medication-assisted treatment using methadone, buprenorphine, and naltrexone helps people recover by managing withdrawal symptoms and drug cravings. These evidence-based treatments work better than abstinence-only approaches, with success rates above 70% when properly implemented. Housing First programs recognize that stable housing is prerequisite for recovery, not a reward for achieving sobriety. These programs show 90% success rates in keeping people housed while providing platforms for addressing addiction, mental health, and employment issues. Mental health integration is crucial because dual diagnosis, addiction combined with psychiatric conditions, affects most people with substance use disorders. Treatment programs that address both issues simultaneously achieve much better outcomes than those targeting addiction alone. Economic development in devastated communities provides alternatives to drug economies while rebuilding social fabric that prevents addiction. Job training, education, and economic investment create hope that makes recovery possible and prevents new addiction. Criminal justice reform must replace incarceration with treatment for nonviolent drug offenses. Drug courts, diversion programs, and treatment mandates cost less than prison while producing better outcomes for individuals and communities. The opioid settlement funds, over $50 billion from pharmaceutical companies, provide unprecedented resources for treatment expansion if used effectively rather than diverted to general government expenses. The 5 cities we've examined, Baltimore, Philadelphia, San Francisco, Dayton, and Seattle, represent both America's failure to protect vulnerable populations and its potential for redemption through evidence-based compassion. The choice is ours. Continue failed approaches that waste lives and money, or embrace solutions that work. Which future will we choose?